It'll be good. Well, Alec, I want to thank you for being willing to do this, to talk about Invisalign, you know, the hot topic of the day, really, for your younger colleagues. I really appreciate your being willing to do this. You did a lot of good hard work on this project, so if you could, I guess, briefly, Alex, just maybe hit the top, in your mind, 2 or 3 most important things you'd want somebody who is your colleague and a little younger than you to know and remember about Invisalign.
Yeah, absolutely. So basically the whole purpose that I actually did this literature review was because once I actually got into clinic, you're going to get a lot of questions about Invisalign. It's kind of the new current orthodontic treatment. It's the hot topic. A lot of your patients will be informed about the Invisalign option. So you want to be informed as their provider on how to answer their questions. You want to be able to talk to your patients about Invisalign. Even if you aren't planning on doing Invisalign in your practice in the future, you still want to be able to answer their questions
Good.
they have about the Invisalign program.
Okay. You know, going and trying to focus for just a minute, Alec, on the work you did, what would you say the other things that you would want them to know about Invisalign would be?
Right, so basically, everyone knows the benefits of Invisalign pretty much. It's a lot more aesthetic than the fixed labial braces. It's a clear polyurethane retainer, so it's able to be removed. Patients like it because there's no diet restrictions. They can eat whatever they want. They can take the retainers out when they want. They don't have the brackets and wires that are uncomfortable. But a lot of people don't know the drawbacks of Invisalign. So you want to be informed of what Invisalign can actually treat. With my project, I really found that there was some pretty good limitations on what the Invisalign program can actually treat.
Like what?
Such as extrusion of teeth is very difficult just because it's extremely difficult to have a lever or something to grab onto with the Invisalign system to extrude teeth for orthodontic care.
Okay. You know as well as I do that I try to help them understand that if class 1 molar and cuspid, a GP could treat one of 4 conditions. Using that as a basis, how would you see that fitting into, how would you see Invisalign fitting into that helpful triage tattoo button head?
It's exactly right. The 4 reasons that we do talk about in class with the crowding and the spacing, the Invisalign was the same way. The results that I found, it was 1 to 5 millimeters of crowding or spacing. Invisalign had some successful treatment. However, if it was more than that, the 5 millimeter region was a little bit of a gray area. So anything from 4 or 5 plus millimeters of crowding or spacing,
gray area.
The Invisalign system was not as predictable and had much less successful results over 5 millimeters of crowding or spacing.
Okay. Any final comments, Alex, you'd like them to remember about Invisalign?
Right. Yeah, so basically Invisalign, one of the main indications for the Invisalign that I saw was minor spacing or crowding and also relapse of fixed treatment. So if they've already had a fixed orthodontic treatment and they had very successful results with the Invisalign system, when there was just minor relapse issues.
Minor relapse
issues. So the Invisalign system really struggled treating skeletal deviations, a skeletal class 2, a skeletal class 3. It's really the Invisalign system is strictly to merely rotate or tip teeth. But anything more than just minor imperfections and occlusion, it really had a difficult time restoring.
Alec, thank you so much. I'm sure your colleagues will appreciate your taking the time to share the information with us that you found.
Sure, no
Thank
problem.
you.